Right. I'm pretty new to all of this, and before I embark on what I have to say, I would like to acknowledge the contribution of my teammates from AUDA-NEPAD who have been very instrumental in supporting the work. I've only been around for about 3 months. So, Musa, our environmental specialist and biosafety guru. Christopher, he's our AU and continental specialist. Hope he's around. Of course, many of you know Barbara Glover. She should be on her way in. I also want to recognize somebody who has contributed to AUDA-NEPAD, now retired but present here. We call her Auntie. You know yourself. Justina, you're retired, but you have contributed a lot, so I must give you that recognition. Thank you. So, where's the... So, most of what I have to say has been said. Our business is just to give highlights so that we can all go home and pack our bags, do our reports. So, who are we? It's important to, not everybody is familiar with what AUDA-NEPAD is, but basically AUDA-NEPAD is the new kid on block in Africa as it refers to development. And so we are supposedly the premier development agency of the African Union. And our mandate is to ensure that we serve as the continent's technical interface with development partners and stakeholders. Obviously, it's a lot of work to do. And within our department, we want to look at the health problems facing Africa and how these pose as a development challenge to the African continent. So quickly, to reiterate why we do what we do. Africa's healthcare problems in numbers is scary. It's unfortunate that I don't think the pointer, it's working. So, 50% of Africa's population lacks access to essential health services. This is scary. Somebody earlier on here said that malaria is not really the problem of the people in this room. In many ways, I may tend to agree. And possibly this is why advocacy for the malaria situation, particularly in Africa, is facing challenges, because the people really affected by it are not part of that process, unlike possibly the HIV/AIDS scenario. You can imagine you guys are all scientists and all you're concerned about your endpoints and achieving refined results. But the fact remains is that Africa has significant challenges in terms of investment in research. Member states' contribution towards development, particularly the private sector, in terms of research represents less than 1% globally. And this is a serious concern. We import 70% of our medical products. Up to less than 2% of research in terms of medical outcomes is done in the African continent, in spite of all the biosafety work that you're currently doing. Up to 42% of medical products on the continent are counterfeit. So the African Union Development Agency is faced with serious challenges when it comes to solving our problems. So we also take into consideration that we have a triple challenge, especially when it comes to diseases such as malaria. We talk about access and equity, importantly the quality, but I think the most important is sustainability. And the current malaria situation on the continent clearly shows that the solutions that we have are not sustainable in being able to eradicate malaria. Because earlier on, or I think it was yesterday, a lot of mention was made that malaria is an environmental problem, is a public health problem. But in actual fact, malaria is a developmental problem, contributing to a large proportion of Africa's underdevelopment. How many of you know that the mosquito is the most dangerous animal on this earth? The figures are there to show it. The mosquito is the most dangerous, as small as it is. It's the most dangerous animal on this earth, resulting to over 1 million deaths. I mean, if a snake were to walk into this room right now, you could imagine the reaction. You'll all run away, eh? But when the mosquito comes flying by, nobody really cares. But the fact remains is it is our biggest problem, contributing to a large proportion of the vector-borne diseases on the continent, which is a major problem. So our friend Tutu would normally say, how do you eat an elephant? One piece at a time. And this is what the African Union Development Agency has been doing, taking steps to ensure that we address the problem of malaria based on the decisions taken at the highest level. But quickly, we know a lot has been done in terms of progress. In 2019, 800,000 people were dying every year. 30 years down the line, 600,000 people are being killed because of malaria. So what does this tell you? It means that in spite of all these investments that we've been talking about, it really has tantamounted to nothing. And 95% of these cases come from sub-Saharan Africa, and 96% of those deaths. In fact, last year, we had 11 million more cases of malaria than we had in 2022. And we still seem to be taking malaria as an afterthought. So, it is clear that investments currently in the traditional vector control tools, which has been proven globally, even by the WHO, that vector control is the way forward, is not reflective of the reality on the ground. And for us, within Development Agency, this is a clear and present danger. We all have spoken about why: insecticide resistance, poor quality of medicines, climate change, invasive species. So, what is the alternative? How do we ensure that we support the introduction of sustainable solutions for a development-related disease on the continent? Obviously, a couple of years back, people like the WHO had said that African governments must harness innovation. And this has been very clear from the African Union over the last 10 years. And these decisions, these 4 key decisions, are the hallmark of the governance and driving policies for the work that you do. In 2016, in recognition that innovation would be responsible for Africa's development, the AU member states, heads of states, requested the Science, Technology and Innovation Commission, through their ministers of science and technology, to establish a system for obtaining expert contributions as to which innovations should Africa adopt. In doing so, the African Union Development Agency was requested to set up a mechanism which everyone here has been referring to as a high-level panel on emerging technologies, made up of experts from across the African continent, driven by Africans. And that expert panel came up with a number of detailed suggestions that was dependent on, one, their relevance to political awareness, economic and environment benefits, the technological maturity, the problem to be solved, and the potential risk and benefits associated with the technology. And of the 10 technologies that they looked at, they took a decision on 3 and published their first reports. Dr. Gassani spoke about the first APET report, which has now been taken to the second level that I think Charles spoke about, the second APET report. And the APET report was very clear that Africa needed to harness the potential of gene-drive technology for the eradication of vector-borne diseases. And they have mandated AUDA-NEPAD to support this process, together with other development partners. So, the policy drivers for biotechnology has been clearly established through the Agenda 2063 and the decisions of the African Union heads of state. So there should be no doubt as to whether we need to move forward with an African-led solution, because malaria is our problem, independent of what outside partners from the continent may think, as has been highlighted through potential threats. This is not the first time a moratorium on gene drives has emerged. Way back, I think in Sharm el-Sheikh, there was a big intervention by anti-technologists to pass a motion against synthetic biology and gene drives. But through our intervention, AUDA-NEPAD, supporting African groups of negotiators in putting a stance behind the African position, we were able to overcome that moratorium. So in as much as the IUCN may serve as that, I'm very optimistic that Africa will take its stand. I mean, within the continent, countries like Djibouti itself has already started to express that resolve based on the work that they are currently doing with genetically modified organisms. And I'm sure Africa will toe the line. So, in considering the recommendations of the APET report and establishing a system to harness gene drives through ensuring effective regulatory mechanisms, AUDA-NEPAD had to take into consideration 4 issues. 1, the biotechnology regulatory framework, existing regulatory bodies, their technical capacity, and how all of this could be coordinated. Because current evidence clearly indicates that from the application of a biotechnological product for health applications in vector control, which have traditionally been viewed as health products, within the regulation of vector control tools on the African continent, the regulatory framework is very precarious and very fragmented. Most countries have different ministries regulating vector control tools, whether it's the Ministry of Health or the Ministry of Environment, and there are data and research that have been done to prove this. And the approval mechanisms and requirements for the approval of vector controls coming to market varies across the African continent, which poses serious challenges for existing vector control tools. Now, when we talk about biotechnology, the situation is possibly the same or even worse, because as it stands, only 23 member states have biotechnology laws or frameworks. Of course, we have about 28 member states, as shown here, that are signatories to the Cartagena or to the CBD, but they do not have laws. But by inference, they are bound by those international regulations. So this also poses a serious challenge in addressing the issue of stakeholder engagements, stakeholder awareness, policy acceptance, and regulatory harmonization for biotechnology. So what have we done as a union, as a development agency? We have also taken into consideration the global order and their influences on biosafety regulation, which has been adeptly addressed by Charles and Brenda. Sorry, your name escaped me. So I'm not going to go into that. But just to recap, of course, we have the CBD, the World Health Organization, the Food Health. These are all regulations that build into what Africa needs to take into consideration. But most importantly, within our own framework, within our own context, because biotechnology being embraced by us as Africans to ensure that we develop by addressing those disease processes that hinder our progress must be adopted within our own context. So, our vision as a development agency, considering the fragmentation of regulatory processes that are required to ensure safe and effective development of new technologies, is to have a united African front through what we call the Integrated Vector Management Platform for Africa. Our vision is to create an IVM platform that will create an enabling environment for regional economic blocs and member states to come together and address regulatory issues that would affect our development and affect access to markets for innovative technologies. So, we started this journey by focusing or piloting our intervention at a regional level, which was ECOWAS. And I will go further to explain that. So, our goal was to establish a continent, or is to establish a continental environment as a novel approach in fighting vector-borne diseases. Because, as has been expressed here, technologies such as gene drives and their health applications require the intervention of multiple regulatory stakeholders. And as Dr. Gassani was saying earlier, creating multiple AFURA processes. And it is in our best interest, in order to address efficiency, effectiveness, and speed to market, to harmonize these requirements and to create a continental platform that can provide the advisory guidance on how Africa can adopt these. So, that in mind, we decided to pilot this integrated vector management program in West Africa for a specific reason. One, based on the APET report, we have been provided guidance as to the type of technology we to adopt, which was gene drives. And of course, which would directly affect the vector, the mosquito vector, which carried the biggest disease-causing problem and parasites, which was that for malaria. So we chose our Pathfinder technology to be gene drive. We chose the Pathfinder disease to be malaria, and the Pathfinder region to be West Africa, because West Africa bears the greatest burden of malaria, over 70%, and of course 90% of the deaths. So, building upon our experiences within West Africa in building an integrated vector management platform where various stakeholders are brought on board to take regulatory decisions, we now plan to expand this and build onto a continental approach. So, that continental regulatory platform would learn from the ECOWAS experience, and we would ensure that we expand our ECOWAS regulatory platform to the other regional economic blocks using a multi-sectoral approach, health, environment, agricultural, ethics, being brought together to take regulatory advisory decisions that would facilitate the competent authorities in taking regulatory decisions. It will be multidisciplinary, involving entomologists, ethicists, social scientists. I know my time is running out. Just a few more minutes. I'm getting the eyes from the director, but I have to go through this. And of course, the ultimate target is to address vector-borne diseases using gene drives as a pilot technology, malaria as a pathfinder disease, with the potential to eradicate other vector-borne diseases on the continent. So the IVM platform for West Africa was established with a specific governance structure. Now, where ECOWAS presents a peculiar situation because at the time, they were the only regional economic bloc that had a regional health authority that took decisions that were binding among its member states. Today, we are even in scaling up to the continental level. We are now opportuned because ECOWAS is also now establishing a regional biosafety authority, which will facilitate decision-making within the member states. Of course, the resolutions have been signed, the regulations have been adopted, but that regional biosafety agency needs to be operationalized, which will be part of our scaling up in ensuring a regional approach to decision-making in biotechnology, whilst at the same time bringing on board other stakeholders, which are the ethicists. So the West African IVM platform is composed of a steering committee within which we have heads of the various regulatory agencies, which are then supported by various technical working groups, which have been able to develop guidelines to support decision-making within the West African space and by context at continental level. The guidelines and regulatory documents developed by the West African IVM have now been published on the Biosafety Clearinghouse, which are now available to the rest of the member states. Brenda made mention of that. And there are 7 guidelines which are able to help with the regulatory decision-making process. So the success achieved in operationalizing the West African IVM has attracted the need to scale up, because we are now having interests. We initially involved the 15 member states, and there were 7 countries that we supported as a program in strengthening their capacity for risk assessment, building IBC capacity, establishing institutional biosafety committees, engaged in stakeholder engagement and policy engagement, taking high-level policymakers on international study tours, creating an awareness of the opportunities gene drive. We now have interest coming in from other countries, such as Ghana, Nigeria, Sao Tome, Uganda, Tanzania, Ethiopia, Comoros, where some of the product developers are already in operation or planning to start operations. So, our interventions have been primary and secondary, focusing on horizon scanning, identifying stakeholders involved in gene drive development and biotechnology, and creating knowledge sharing platforms to benefit African scientists. We have been involved in engaging regulatory agencies through strengthening their capacity through various training workshops and developing guidelines, as I mentioned. And we have also engaged policymakers in advocacy, in policy acceptance, and of course, engaging communities through advocacy, through the APET report that had recently, priorly been launched by the African Union Commission, and the recent report. In terms of regulatory system strengthening, we've been addressing political support, engaging in adoption of regulations that consider the weight of health when balancing the potential risk, of course, increasing competence and skills, and sound regulations for ethical considerations, and most importantly, ensuring harmonization across the region and adoption of these regulatory policies. So, a number of milestones have been achieved. We have the opportunity of discussing this in tomorrow's meeting, so because of time, I have to go through this. We've also been engaged in publications which are readily available as an outcome of the work that we have been doing. And of course, most importantly, the second edition of the GeneRI report that has come out with 9 recommendations to be adopted across the African Union space in terms of adopting innovative biotechnology vis-a-vis gene drives. And these are the guidelines that Brenda was referring to, and as our program has now been able to develop these policy guidelines that will support regulators across the continent in taking regulatory decisions. So, we are advocating for the change in which we regulate health products, because in the space of gene drives, we have to ensure that because of the involvement of all of the various stakeholders from environmental, biosafety, health, and ethics, we have created through the IVM program a structure that takes into account African values and protocols. We've been able to bring together the various stakeholders for developing policies, and we are creating a framework of cooperation, but most importantly, we're providing the regulatory tools that African decision makers need to adopt this new technology. Of course, this leaves us with some inconclusive decisions as to how we classify the gene drive technology. There are 3 ways of looking at this. Obviously, gene drive mosquitoes would be classified as LMOs, as has been previously said, under the Cartagena Protocol. But from a vector control perspective, we can use the regulatory classification approach from the WHO, where WHO guidance documents provides the relevant guidance as to how these technologies can be deployed from a public health perspective. And then there's the opportunity of looking at them from a biological control agent. We still have not yet defined the pathway or the decision. The science behind the technology has been adequately discussed throughout the course of this conference, and African regulatory policymakers still need to decide which approach needs to be used, and this is the stage at which we are now. We've provided the capacity for them to take decisions. However, we are still not very clear as to the regulatory classification and the pathway. But what is clear is that with the current genetically modified organisms that are being deployed, there are 2 pathways to consider, which is one, the entomological approach, and the second one, which is the epidemiological approach. The decision to which path to take and which technology to adopt is left to the member states. As the African Union agency, our business is to support and develop the capacity of individual member states in taking these regulatory decisions. But what we realize, and the mandate we have given, that it is in the best interest of the African continent to harmonize and coordinate these decisions. So at the regional basis and at the continental basis, it makes it easier for product developers to navigate the waters the turbulent waters of going through the approval process. So currently, for those of you who may not be aware, these are the countries within the African continent that are actually involved or being ready to be involved within the gene drive development process. There are currently 4 product developers that we are aware of as it relates to gene drives, which is Target Malaria, Transmission Zero, Oxitec, and UCMI. Of course, Oxitec is not within the gene drive space, but they are within the genetic modification development process. And so we have about 9 countries or 10 countries that are currently involved in this. So, but of those countries, Burkina Faso is taking the lead, and this is where our program has really focused in supporting them to develop an institutional biosafety committee. We have supported them to establish a national IVM platform where stakeholders are able to come together and take decisions that would facilitate the research and the development that is ongoing. So beyond the West African state or the African continent, we have been intensely involved at the international level at the various international negotiations. And our intention is to ensure that the African interests are protected. So as an IVM program, we have actively been involved at the CBD. We've been training African negotiators to ensure that they represent African interests. We are planning to ensure that we engage in the IUCN activities, and will be involved in other global collaborative efforts to ensure that the process of gene drives is effectively adopted within the space. Of course, for every project, they are not without challenges. And our biggest challenges have come from regulatory buy-in, harmonization, and finance. And I talk about finance because within the African space, if we are to adopt genetic modification as an option to fight against vector-borne diseases, those of us within the research community and those of us within the implementation space, ministries of health, ministry of environment, we need to ensure that we start to accommodate budgeting for these integrated vector approaches. Because as we're all aware, the funding opportunities are drying out, and it is imperative that we start to address the financing models for the research that is ongoing. So, second to that, is the public perception acceptance that we face as a program at the political level and at the community level. But what we have come to realize from the data that we have is that this challenge doesn't come from the science or the data that is available. It is mostly related to the misinformation, the trust and cultural sensitivity, and balancing the relevant perspectives, and of course, national priorities. So, in short, this is what we have as a program, and the call to action here is that we need to be able to work together as stakeholders within these platforms that the African Union Agency is propagating, building upon the work that we have done from the West African region, and we hope that we are able to create a continental platform where all of these discussions would be able to consolidate it for the Africa that we want for tomorrow. Thank you.